the beta oxidation of other fatty acids. So beta oxidation of odd chain fatty acids, if we have to perform, then what will be the end result? So let's talk about a 17 carbon fatty acid. Now guys, when we are doing the beta oxidation of these odd chain fatty acids, what will happen? So in the last cycle, we will be having 5 carbons instead of 4. So we will get 1 acetyl-CoA out, but 3 carbon will still be remaining. And that 3 carbon, guys, is called as propionyl coenzyme A. So what is the fate of this propionyl coenzyme A? Guys, this propionyl coenzyme A will be acted upon by the enzyme that is called as propionyl coenzyme A carboxylase. All the carboxylases are biotin dependent. So this enzyme converts propionyl CoA to the methyl malonyl coenzyme A. Now this methyl malonyl coenzyme A is acted upon by the next enzyme that is called as methyl malonyl coenzyme A mutase. This enzyme is vitamin B12 dependent. B12 adenosyl cobalamin. So this converts methyl malonyl CoA to succinyl CoA. Now guys, succinyl CoA, as we know, is the intermediate of Krebs cycle. So this can enter into the Krebs cycle. Now guys, in the Krebs cycle, this can generate oxaloacetate ultimately. So guys, now talking about questions on this topic. So what is the end product of the beta oxidation of odd chain fatty acids? So yes, it is acetyl-CoA, but one molecule of propionyl-CoA. How many ATPs are produced in the odd chain fat oxidation? Let's say 17 carbon was given in the question. So guys, for the calculation purpose, we will be having one less acetyl-CoA compared to the 16 carbon fatty acid, right? Okay, because 3 carbons are taken away in the form of propionyl-CoA. So what I will get? I will get one less acetyl-CoA, so 10 ATPs less. So suppose 16 gave me 106. Now the 17 carbon fatty acid will give me 106 minus that 10, right? So 10 ATPs will be less compared to that even chain fatty acid of the nearest part, right? Now the point is, what are the disorders? So in the disorders group, guys, the most important point is a disease that is called as methylmalonic aciduria. Methylmalonic aciduria is a disease which may be caused by vitamin B12 deficiency or the deficiency of the enzyme that is called as methyl malonyl coenzyme A mutase. Because if this enzyme is missing, then the methyl malonyl CoA will accumulate and this will cause the severe acidosis, right, which may result in the CNS damage to the newborn kid or even death because of acidosis. So this is one of the important disease in this case. So guys, if someone asks you the marker of B12 deficiency, biochemically you can say one word, and that is methyl malonic acid. Levels are increased in B12 deficiency, right? Because B12 is participating in the reaction that we have discussed.